Hello everyone, it's good to have you back on the show again. Your health, your life. Today we're going to be talking about urinary tract infections. And some material we're going to cover in our discussion. We're going to define what a UTI is, or urinary tract infection, what is likely to cause it, what symptoms you're likely to present with, how we can treat it, what complications can develop if not treated, and most importantly, how you can prevent the chances of you getting a urinary tract infection. Before we begin, just a reminder, don't forget to subscribe to our YouTube channel to receive more content like this one. So without wasting any more time, let's get into it. So what are UTIs? Generally, urinary tract infections are infections of your urinary system. And we know that your urinary system is made up of your kidney, your ureter, which is simply a tube from the kidney going all the way into the bladder, which also makes up the urinary tract system. Then from the bladder you have the urethra, through which urine comes out. So when you have infection in any of these structures I have mentioned, the kidneys, the ureter, the bladder, or urethra, we may refer to it as a urinary tract infection. What symptoms are you likely to experience? Most people are going to complain about pain in the lower part of the abdomen. Others are going to complain of frequent urination, pain when urination, and this pain is usually described as burning in nature, like you feel something burning each time you go to pee. Other symptoms that can be associated with what we've already mentioned include high temperature, feeling very hot, feeling very cold. You can have a headache. Other people also have nausea. Others actually vomit. Others also have diarrhea. Because of that, it's very common for people to mistake a UTI and malaria. So some people, even just for malaria it's negative, but end up treating for malaria anyway, because sometimes the symptoms seem to overlap. Who has a UTI? UTIs are going to affect both men and women, but they're more likely to happen in women for two good reasons. One, the space between the vagina opening in a woman and the anus is very short, so it's very easy for bacteria to move from the anus in the rectum all the way into the vagina. So that's very easy to happen. And the most common bacteria that cause UTIs actually come from stool. So that's one reason. The second reason is that the urethra in females is shorter. It's about 5 centimeters on average. For men, it's about 16 to 20 centimeters. So it will take quite a short amount of time for bacteria to migrate all the way from the opening of the urethra to go inside the bladder for women than it would for men, which in most cases they have a lot of time to flush it out each time they pass urine, as we're going to discuss when we reach prevention. Things that can predispose one to developing a UTI. One thing, pregnancy. So pregnancy itself has been known to predispose someone or to make you more likely to develop a UTI. So pregnant women are at risk of getting a UTI. 2, diabetes. If you're diabetic, you have increased chances of developing a UTI. 3, anything that can weaken your immune system. Usually in our setup, it's likely to be HIV and AIDS. So patients that have HIV and AIDS are also likely to get urinary tract infections. As our fathers get older, so the elderly men in the population, their prostate begins to enlarge. When it enlarges, it also increases their chances of developing a urinary tract infection. So those are the things that can predispose someone from getting a urinary tract infection. How can we confirm that you have a UTI? Well, when we come to the hospital, we'll ask for a urine sample, and that will give us an idea of you having a urinary tract infection and what drugs are likely to be effective. How do we treat it? We'll give you antibiotics. Now, a special note on this. You see, this bacteria that infects the urinary tract system and other bacteria that infect any part of the body, they have a tendency to adapt to the drugs. So when a bacteria adapts to the drug can no longer be effective to treat the infection. And this is very common for UTIs. So you should come to the hospital so that we should test your urine and see which drug is likely to work for you. Because what will happen is that if you keep buying over-the-counter drugs and taking the drug for a UTI that you may think you have, or for any other reason, you may find that most of the common drugs are going to adapt with you. That happens. And you may end up buying very expensive drugs just to treat your UTI. In that event, it will become a very severe UTI. What are the complications you can have from urinary tract infection? 1, you can have infection of the kidneys themselves. You can have severe infection Usually most UTIs are mild in nature, but they can become severe. The symptoms we mentioned can be even more prominent, and you won't have energy, you'll be bedridden, and you may have to be admitted in the hospital. Yeah. So that is what we're trying to prevent. How can you prevent getting a UTI? Well, we already mentioned that the anatomy of women is a bit different from that of men. And we've already mentioned that in most cases, the bacteria that causes a UTI comes from the rectum in our stool. So what should women do? Well, women should be wiping from the front to the back to prevent that movement of bacteria from the back to the front. And by that we mean from the anus to the vagina. Other things, take a lot of fluids. Stay well hydrated, because the more you urinate, the more you flush out bacteria that is likely to accumulate in your bladder. Don't hold your pee again. If you feel like going to the toilet to pee, go to the toilet and urinate. The longer you hold your urine, the more time you leave for bacteria to multiply. Women should also avoid scented products that they may use to clean their private parts, because those have been associated with increased chances of you introducing another bacteria into your genitalia, which eventually is going to infect the urinary tract system. Food products like yogurt have also been known to reduce the chances of you developing a UTI. Yeah. So that's what I had for you. Remember, a UTI can happen to anyone, more common in women. There are ways that we can prevent the chances of us getting a UTI. So just go through the video once more and familiarize yourself with the symptoms that a UTI can prevent with. Don't forget to subscribe to our YouTube channel for more content like this one. Thank you very much for listening, and have a beautiful day or a beautiful evening. Thank you very much.